Hi, this is Jason Salami. I'm an associate professor of epidemiology at the University of South Florida College of Public Health. And the purpose of this quick video is to cover something that is very recent and, to be honest, is long overdue. You may have heard me and others preaching about the fact that Florida was one of only 3 states, the other two being Hawaii and Kansas, that were failing to report information on current hospitalized people with COVID. And so finally that information started to appear yesterday. And so I'm just showing a snapshot. It isn't much, and I haven't been able to find a lot of documentation on exactly how this is generated, but it reads hospitalizations with a primary diagnosis of COVID, and it basically provides information by county and overall for the entire state. That's what the grand total is there. And it seems to be updated about every 15 minutes. And so, again, this is the community coronavirus dashboard. You will, at least based on my last check, you will not find this information on the Florida Department of Health's main dashboard. I think they're relying on the information on the left reported by the Agency for Healthcare Administration. But on the community coronavirus dashboard, you will find this information now appearing there. This is just an example of Broward County. It says the current hospitalized for COVID-19 is 1,005. So on the community coronavirus dashboard, you will basically see the current number is just kind of reading what's reported in the ACA spreadsheet, but making it available so it's a one-stop shop along with all of the other information on that dashboard. And then what I've decided to do with my visualization, you can check it out, is give you more of a historical purview. So I've got a bunch of different visualizations. This is just one example. So I've taken the information, again, it's reported as of yesterday in 15-minute increments. That's a little bit too granular. So what I've done is I've looked over 8 different 3-hour windows within every day. And within each 3-hour window, I've basically, taken the maximum number of patients that were reported at any given point in time. And again, I'm presenting this information over time. So for example, Broward there says 969, 969, 969. So for a while, they didn't change in terms of their total hospitalized patients with COVID. And then it increased to 1,004 and then 1,005 in these 3-hour increments. And so again, we can very granularly now follow and track how those numbers increase and decrease. Of course, they can increase when we have new patients. They can decrease when we have patients who die, who are released, and so a lot of factors go into that. And then, of course, I've got a simplified version where right now, again, there's only 2 days that are available, but I will provide this information on a daily basis as well. So again, because I think, not only reporting on what we see currently, but how we're trending over time is very important. One thing I'll say about why this is so important, this is just one of my snapshots from my dashboard. There is a variable that's called ever hospitalized. So for all of the cases of COVID-19 in Florida, we have this field or data element that says, were they ever hospitalized? And right now that says 3.4%. Of course, the problem with that is there's an overwhelming number that are actually missing. This is information from Duval that I'm going to talk about in just a second. And so why am I going to talk about Duval? Well, as soon as this information came out, we've got a bunch of brilliant people who are out there. Rebecca Glassman actually tweeted out and said, the Florida Department of Health reports that Duval County has a total of 419 COVID patients who have ever been hospitalized. So again, this is a downloadable data set with information on every single case in Florida. And in that, we have county of residence, and in that, we have that ever hospitalized variable. And so if you restrict to Duval County, you get 419 patients. And again, this goes back all the way to the beginning of March when they started to provide this information. But right now in Duval County, it says that there are 457 patients with a primary diagnosis of COVID-19. And of course, those two numbers don't reconcile well with one another, because again, how can 419 since the beginning of time or the beginning of tracking in this pandemic in early March have been ever hospitalized, but there's more than that are currently hospitalized? Very confusing. So I dug a little bit into this. And so again, we've got 2 pieces of information here. The ever hospitalized variable is a data element in the case level downloadable data set from the Department of Health. 53% of individuals of confirmed cases are missing this data element, or it's defined as unknown or null. So again, missingness is a big problem. And again, for more current cases, I understand that. We may have somebody who just popped in there today, tested positive on a lab test, and maybe we haven't done the contact tracing. Maybe we don't know if they're going to be hospitalized, but 53% is a pretty high number for missingness. And the key here is, because I'm going to try and explain why there's a discrepancy between those two numbers that Rebecca pointed out. This is reported for Duval County if the patient, so again, at the patient level, is a resident of Duval County, right? So patient level, and you have to be a resident of that county. Compare that to what we're getting right now from the Agency for Healthcare Administration, that brand new, refreshed every 15 minutes data set. The currently hospitalized population. Well, that is the county level downloadable data set. I already alluded to that, and updated every 15 minutes. Only those with a principal diagnosis of COVID-19, in this case, if you are scanning ICD-10 codes, that's the U07.1 code, only they're included. I'll touch on that in just a second. And then reported if the hospital is in Duval County. So, if somebody from outside of Duval County came in, had COVID-19 and was hospitalized in Duval County, it's going to count for Duval County, not the county that they permanently reside in. Why would that happen? Well, I'm going to get to that in just a second. So I mentioned that, if we're trying to explain the discrepancy, so first of all, I mentioned that the ever hospitalized field was missing 53% of the time. Well, in Duval County, it's missing 68% of the time. So again, missingness and underreporting the total number of cases that have ever been hospitalized could be a reason why we're seeing such a low number than what we would expect based on the currently hospitalized population. But here's another plausible factor that's going into the difference in these numbers. So this is Duval County, where Jacksonville is located. And so I want to point out all of these X's are counties that don't even appear on this new ACA data set that's coming out, that county level listing of those who are currently hospitalized. These counties don't even appear. And my supposition for that is these are counties that don't have a hospital at which those people might be hospitalized. I'm guessing, because I can't come up with another good reason why these counties would be left off of that report. In addition to that, these counties actually have 0 counts in there, right? 0 people in hospitals with COVID-19. And so what might be happening here is this. People, because maybe Duval County has, better hospitals for handling more serious cases, these people might be influxing into Duval County. And so again, if we're talking about the ever hospitalized field on the downloadable case level information, this would be documented according to Hamilton County, Suwannee County, Union County, if these people are permanent residents of those counties, not Duval County. But on this brand new report on the currently hospitalized, because the hospital that they're receiving care at is in Duval County, they're going to count for those numbers in Duval County. Not only that, and again, this is why the data dictionary and an understanding of how they produce this data set is so vitally important, is this happening? Are we getting people from Georgia that are coming down and receiving care in Duval? And again, these are non-residents of even the state of Florida that might be coming down, getting care in Duval County, and maybe they're being counted as a COVID-19 patient in Duval County. And so again, we need to understand what that data set entails, have a data dictionary to really understand why, these discrepancies might be occurring. Quickly, I want to cover one more thing. So again, I mentioned that the current hospitalizations from ACA right now is only a primary diagnosis of COVID-19. So when somebody goes into the hospital, they might receive any number of different diagnosis code fields. It might be anywhere. In this case, I put up to 30 different distinct diagnosis codes that somebody might receive. So if somebody gets documented with this U07.1, that is the primary diagnosis. They might have 29 other diagnoses that are listed on here, but if the U07.1 is the principal, they would be included in this brand new report that we're receiving on current hospitalizations for COVID patients. If it happened to be the second diagnosis code, so not the primary, these people would not be included. So this is not capturing all patients with COVID-19 who are hospitalized. And so why one of the perhaps many reasons this could be a problem is this is the guidance from CDC on pregnant women with COVID-19. And so it says here that during pregnancy, childbirth, etc., a patient admitted, sorry for that little pop-up, a patient admitted because of COVID-19. So notice I'm saying because of. COVID-19 was the reason that this pregnant woman was hospitalized. They should still receive a principal or a primary diagnosis of 098.5. So basically it's not the COVID diagnosis. That is how the coders are supposed to code this information for a pregnant woman. So again, the plain and simple of this is a pregnant woman who's hospitalized because of COVID-19. That was the driver for her admission. She will not receive a principal diagnosis of the U07.1 and would not be included in this current hospitalized patients with COVID. So again, maybe this makes up a small proportion, but maybe there are a lot of other circumstances where, again, we might be missing a lot of patients in this current report. So I tried to figure out just briefly, what are other states doing? Are other states only including the primary diagnosis? Is it any diagnosis? Are they not even using diagnosis codes and they're relying on hospitals to compile a list in a different way? This is Texas's dashboard. They give a lot of good information. Total staffed hospital beds, how many are available, how many available ICU beds, how many available ventilators, lab confirmed patients currently in hospitals. That's great. They give a timeline on this. They've been doing this for a while. But I don't know what constitutes a COVID-19 patient in a hospital. Again, is this based off of a diagnosis code? If it is it only the principal? Is it any diagnosis code? Or are there other ways that they're determining this? This is Arizona, another state that has had a recent uptick of cases quite dramatically. I'm just going to point you out to the very bottom of this. So forget about the nice graphics here. It says percent of COVID-19 cases with missing hospitalization status, 63%. So very similar to the scenario I gave you in Florida. And if they're relying on this, then again, you talk about underrepresenting or underestimating the current number of cases that are hospitalized. This is California. So California gives much more specific data. So I'm just going to read the top portion. The number of patients hospitalized in an inpatient bed who have laboratory confirmed COVID. This is not a cumulative number. This includes all inpatients and does not include patients in affiliated clinics, outpatient departments, emergency departments, right? But what this tells me, or what I'm going to guess, is it's not just the principal diagnosis in California. It's if you're hospitalized, regardless of what diagnosis codes you receive, but if you have laboratory confirmed COVID, you're going to be included. This is New York. New York says we link a lot of data sources. So if we find out that somebody's a case, we're going to try and link you to all of these things. The Syndromic Surveillance Database, regional health information organizations. But again, how you ultimately come up with, who actually gets captured in those daily hospitalization numbers. I won't say it's a black box because, again, I haven't done my due diligence in checking all of these because I wanted to get this information out quickly. But we just need more transparency and an understanding of, is there, and I'm guessing there is, a lot of variability in how different states are defining current hospitalizations due to COVID. Because if there is a lot of variability, then we really shouldn't be comparing what's going on in states. We should be comparing what's going on in states with a similar definition, or encouraging states to adopt a uniform definition that makes the most sense to everybody. So other information that would be valuable, even though we're now getting the current hospitalized patients, intensive care, like how many are currently in an intensive care unit. I'd like this not just by county, but by hospital, again, to give us a more granular understanding of where hospitalized cases are distributed. I'd like some characteristics of those who are hospitalized, at least things like age and gender and race, ethnicity, again, just to be able to drill down and get more granular information. Can we get both principal and secondary diagnoses? You may not want them lumped together. That's fine by me. Give me the number that they're reporting now on primary diagnosis, but also give me another number, even if it's only at the county level, of those who may not have a primary diagnosis, but who have any diagnosis code of COVID-19. And then it'd really be nice if they have, I know they just started to report and make this information available yesterday, is there any historical data? Because you'll find if you go to my dashboard right now, 2 vertical bars because there's only 2 days is not a good curve from which we can say, well, how are we doing relative to what, right? We have no historical data on that. So that's it. Just wanted to start talking about this information and try and improve it over time. Thank you so much.